Hello there, it's Daniel Dahdah, and I'm looking at leg length differences. This is a leg length difference that's actually induced by growth over a period of time, whereas if we take a look at this x-ray here, we'll actually see that this is an artificially induced discrepancy, and we can see that the insertion of a artificial hip replacement's been done on one side in here, and you can see that the difference between the top of the roof of the hip joint, called the acetabulum here, is quite different to this one over on the opposite side. It's actually 122 millimeters or 12.21 centimeters. So 122 millimeters down to 104 millimeters, which results in an 18 millimeter discrepancy between one leg and the other. So what do we do in situations where we've actually got now a hip replacement, which was given to the lady because that she was experiencing hip problems, and we've actually got somebody in here that's also got a 14 millimeter difference between? How do we actually help boost this? Because what's taking place is that there's going to be compression in this situation on the left hand side, that being the left hand side there, and that leads to arthritis. Can we actually put in an added lift in here to boost this joint up in here, opening this joint down in here? Well, it's possible. Certainly possible to be able to put a lift in on this side in here to lift this side up and take pressure off that side. We would need to use some sort of approach where we trial that and see whether the person is experiencing the benefits, whether there's reduced knee, hip or low back pain, or even higher up, reduced headaches. We can also do the same thing in this approach in here. Now, this lady has a 18 millimeter discrepancy. What would we use? Well, probably we'd go for something that might be a 9 to 12 millimeter lift, and just take a look at what that would do for her, whether she feels more balanced when she's walking. And that was the reason why she phoned, because she was feeling quite off balance as a result of the hip surgery. And so what do people with hip surgeries do? They do need to balance themselves out, otherwise it leads to further wear and tear elsewhere up the spine or even further down the limb. And the literature actually backs that up, that hip and knee arthritis and conditions are more noted in people with actually a discrepancy between one leg and the other. We can actually insert a lift into the back of the shoe, and that lift goes into the heel, which is just over here, and it's placed obviously in the shorter leg side. And the lifts actually look something like this. So there are different styles of thicknesses as well, but it's a very economical way without actually having to purchase new shoes or get your shoes resoled down in here. Very economical way in terms of balancing up something that is showing quite a discrepancy, and it can actually help people that have got this hip surgery that's being done, or they may have actually got one leg shorter than the other, and that does happen in quite a few people, the majority of people. But especially when there is a chalk and cheese type difference between before the surgery and after the surgery, I'd recommend that all hip surgery patients have a standing x-ray which shows this sort of analysis between one leg and the other. And if it does come up that you've actually got a discrepancy down in here of greater than 7 millimeters, it's certainly worth your while considering or trialing something that goes in the back of the shoe. And what you can do is you can actually trial that out. Again, not an expensive option, but what you can do is trial that out to see if you feel more balanced, and then your hip has actually got a much better chance of recovery as well. All right, just some supportive advice for those people that are undergoing hip surgery and what you may find following the surgery, and that is that you feel unbalanced. And this is something that you can do about that. If you'd like some more details, get in touch with Anatomical Heel Lifts on the website, or heellifts.com.au, and test out how you can actually rebalance yourself following hip surgery.